Good morning, everyone. Thank you very much for joining us. I know folks are still entering the room. We're thrilled to have you here on this Thursday, the last day of our Smart Start 2021 conference. My name is Amy Cubbage, and I'm president of the North Carolina Partnership for Children, NCPC, and I'm honored to be able to introduce this wonderful session that we have planned, or these presenters have planned. I'm grateful for everyone for converting sessions and participation so seamlessly and smoothly to the virtual world, and hope that next year we'll be back in person. If you would please check to make sure your audio is muted for most of the session so we can hear the speakers best, that would be greatly appreciated. And without further ado, I will introduce the session, which is on screening, supporting, and securing connections, home visiting, and SDOH ACEs. And of course, in the early childhood world, in my former job, I bet many of you have been in positions where you are the keeper of the glossary of the alphabet soup of early childhood. So to say social determinants of health, SDOH, and ACEs, adverse childhood experiences, ACEs. Our presenters today are Kim Friedman from Family Connects International, Ellie Erickson of Family Connects Durham, and then Debra Best of Family Connects International. And without further ado, I will turn it over to you all. Thank you for being here.
Thank you so much, Amy. We're so happy to be here, and so happy to see everybody coming in from all over the place. I've been seeing in the chat. Thank you all for putting your name and the organizations you're working with, and my favorite, the words that are describing how you're feeling today. I've seen a lot of hopeful and invigorated and energized, and definitely some tired and stiff, which I would also echo from sitting in front of Zoom. So I am excited to hear that everyone is here, and we're really happy to be able to share with you some of our thoughts, and we really want to have an engaging format after we present a little bit to you, to be able to have some discussion, which will be terrific. So as Amy mentioned, we are, I'm trying to advance my slides and my computer is, there we go. Now it's paying attention. So it's feeling tired and stiff too this morning. We are going to be talking with you today about screening, supporting, and securing connections, and really the connection between home visiting and the medical world. So this is the agenda for today. We're going to do a little overview on social determinants or social drivers and adverse childhood experiences, talk through the role that community service providers and home visiting can play, and then talk about examples of collaborations happening now, and then go to a break in a breakout room and some small group sharing. All right. And then, so I am Debbie Best. I'm a pediatrician and medical director for Family Connects International. I also serve as our practices champion for Healthy Steps, which is an embedded behavioral health program within primary care. And previous to my role with the national office was the medical director for Family Connects Durham. And I'm going to turn it over to Ellie so she can introduce herself, and then to Kim.
Hi, everyone. I'm Ellie Erickson. I'm a general pediatrician at Duke Children's Primary Care and the current medical director for Family Connects Durham. I'm also our practice's Reach Out and Read champion, and really excited to be here to meet with all of you today. And I'll pass it over to Kim.
Thank you. Kimberly Friedman, Director of Policy and Engagement for Family Connects International, and looking forward to our time with all of you today. I'll pass it back to you, Debbie.
Thank you. So we're going to start with just talking through setting some common vocabulary around social determinants of health, what they are, what is their link to health, and adverse childhood experiences as well. So social determinants of health are the conditions and in the places where people live, learn, work, play, and they affect a wide range of health risks and outcomes. And so these circumstances are shaped by intangible factors such as political, socioeconomic, cultural constructs, as well as place-based conditions, including the access to healthcare, education systems, safe environmental conditions, well-designed neighborhoods, and the availability of healthful food. Healthy People 2030 uses a place-based framework that outlines 5 key areas of social determinants of health. So economic stability is the connection between the financial resources that people have and their health. And so this includes key issues such as poverty, employment, food security, and housing stability. Education includes key issues such as high school graduation, enrollment in higher education, educational attainment in general, language and literacy, and early childhood education and development. Healthcare access includes key issues such as specifically that access to healthcare and quality healthcare, access to primary care and preventative measures in particular, health insurance coverage, and general health literacy. Neighborhood and built environment includes topics like quality of housing, access to transportation, availability of healthy foods, air and water quality, and neighborhood crime and violence. And then social and community context includes topics like cohesion within a community, civic participation, discrimination, conditions in the workplace, and incarceration. Adverse childhood experiences are traumatic events that occur before a child reaches the age of 18, and that includes exposure to trauma associated with experiencing violence, abuse, or neglect, witnessing violence in the home or community, having a family member attempt or die by suicide, or growing up in a household with substance use problems, mental health problems, instability due to parental separation or divorce, or household members being incarcerated. The examples above are not meant to be a complete list of adverse experiences. They were just the ones that were studied in the original Fletty adverse experience study. There's, as you all know, many different traumatic experiences that could impact health and well-being, including poverty and the effects of racism. The Building Community Resilience Pair of Aces tree image that you see here grew out of the need to illustrate the relationship between adversity within a family and adversity within a community. The leaves on the tree represent the symptoms of ACEs that are easily recognized in clinical, educational, and social service settings, such as well child visits in the pediatric world or a preschool classroom. Adverse childhood experiences can increase a person's risk for chronic stress and adverse coping mechanisms and result in lifelong chronic illness such as depression, heart disease, obesity, and substance abuse. Physical or sexual violence or abuse or neglect are often less obvious, but can exist as chronic stressors as well. And you can see here the tree is planted in poor soil that's steeped in systemic inequities, robbing it of the nutrients that are necessary to support a thriving community. Adverse community environments are just as important as the adverse experiences, and they include the lack of affordable and safe housing, community violence, systemic discrimination, and limited access to social and economic stability, or mobility rather, compound into one another, creating a negative cycle of worsening soil that results in withering leaves on the tree. And so you can see how the social drivers of health, the communities that individuals are in are affecting these adverse experiences. And we know that human brain development is the greatest at very young ages. It's susceptible to the effects of chronic stressors. And so you can see on this slide, it illustrates how 90% of a child's brain development, from sensory to language and higher cognitive functioning, happens before age 5. And the impacts of this exposure can be long-term. The constant activation of the body's stress response system due to the chronic or traumatic experiences in the absence of caring, stable relationships with adults, especially during these sensitive periods of development, can be toxic to brain architecture and other developing organ systems. And so children exposed to stimuli which result in this sustained activation of the stress response are at a greater risk of a range of physical and socio-emotional outcomes through the lifespan. Learning how to cope with adversity is an important part of that healthy development. And so without caring adults to buffer the children, the unrelenting stress can cause these long-term consequences. And many of you have probably seen this pyramid that comes from the original ACEs study, which proposes the mechanisms by which these adverse childhood experiences can influence health and well-being, from the experience of the individual adversity to leading to disrupted neurodevelopment, leading to social, emotional, cognitive impairment, and then the adoption of health risk behaviors, which can increase the prevalence of specific diseases, disabilities, and eventually have earlier death outcomes. There's so much work being done in that space of disrupted neurodevelopment at this point right now that we're starting to understand what the actual changes are happening in the developing brain. And this slide just depicts the many changes and lasting impacts that we can see from mental health to chronic disease to risky behaviors and decreased opportunities in education, occupation, and income. Here we see how the compounding effects of the number of risk factors that a child is exposed to increases the chances of having developmental delays. But it's not all bad news in terms of what we can do to support families. We know that the most effective prevention is to reduce exposure to extremely stressful conditions. And there are many programs and services that can remediate the conditions or provide stable buffering relationships with adult caregivers. And so research has identified a common set of factors that predispose children to positive outcomes in the face of significant adversity. And we know that individuals who demonstrate resilience in response to one form of adversity may not necessarily do so in response to another. Yet when these positive influences are operating effectively, they stack the scale in favor and optimize resilience across multiple contexts. And so the counterbalancing factors include what's depicted here of facilitating the supportive adult-child relationships, building a sense of self-efficacy and perceived control, providing opportunities to strengthen adaptive skills and self-regulatory capacities, and mobilizing sources of faith, hope, and cultural traditions. So I'm going to turn it over to Kim to take us from here.
Thank you, Debbie. So now that we know how important it is to understand not only the strengths that a family has, but also the challenges that they may be experiencing, so that we can support those strong, the ability to have those strong relationships and to have nurturing experiences between caregivers and children. We've seen that policy move into practice with the screenings that have, the range of screenings that have been developed to identify social determinants of health and ACEs, and many national organizations, including the American Academy of Pediatrics and ACOG, the American Academy of Family Physicians, and others, are recommending regular ongoing screenings for social determinants of health, as well as particularly with ACOG and AAP in that postpartum period, screening and prenatal period as well, screening for maternal depression. Additionally, many states and payers are now requiring providers to screen families for social determinants of health as standard procedure, with reimbursement tied to completing those patient screens. Next slide, please. Some of the leading thinkers on these topics, including Kay Johnson and Dr. David Willis, released just in the last year a really good paper that included some suggested best practices when practitioners are screening for social determinants of health. And these really make a lot of sense, ensuring that that screening is done with a high level of respect for families, that families are reminded of the strengths that they have, and that there's a collaborative conversation around the opportunities to take action related to those vulnerabilities or concerns that might be surfaced through a screening, ensuring that families are provided resources in a range of media, including oral, written, and potentially internet content, making sure that where things might be unclear, that families are asked to come back, that there's a return visit scheduled in the near future, ensuring that there are referrals made very specifically to resources and organizations that can respond to any needs that might be identified, and ensuring that there's a feedback loop, that there's a follow-up to make sure that the need is resolved. And if that need isn't resolved, then making sure there's a process to make additional referrals. Next slide, please. So we think about this kind of care, psychosocial care partnered with medical care as whole person care, which really needs to be collaborative. We've been thinking about this a lot, and thinking about the doors of the medical home really being opened wide to ensure that there is partnership with those organizations and entities, and many of you attending may be part of just those type of organizations that are providing that psychosocial support that is part of ensuring that the whole person is cared for, and that this happens in a very patient and family-centered way, and that there's a high communication flow between all of the partners providing care. Next slide, please. So we see screening as a potential gateway for partnership. And one of the reasons being, if all of these different organizations and entities are recommending that families be screened, we also want to ensure that families at particular points in time aren't subject to multiple duplicative screenings, because that can be challenging. We've also been looking at research, particularly with providers, saying that in some cases, they don't feel that they're necessarily the right folks, being medical providers, to be doing the screening. One reason might be because they don't have enough time, because they don't feel that they have a good infrastructure to be able to do all of those 6 R's, particularly the referrals and or the follow-up when a referral might not be successful, unfamiliarity with screening tools, sometimes challenge in billing for that time, or just a lack of confidence in feeling like, feeling a little bit of discomfort with doing screenings. Next slide, please. So we looked at a 2019 study that was done by Public Agenda, which asked families how they felt about being screened by their medical providers. Some of the things that families indicated were that they were worried that they might be judged or discriminated against if they disclosed sensitive needs that they had. Worry that if they disclose needs, that they may end up with a referral to child welfare, feeling like things might feel very rushed during an appointment, or if they disclose a sensitive need, and are not able to get any help from their provider, then that could be really frustrating for them. Next slide, please. So the parents were also asked, what would you want to change or have happen during these if you're screened? And one of those suggestions was make sure that whoever's doing the screening, we have a trusted relationship. Let us know that you're screening everyone so we don't feel stigmatized if we're being screened and don't feel targeted. Let us know what the results might be transparent about which findings could lead to or trigger a referral to social services, and have the resources that we need if you're going to ask us about our needs, have an ability to follow up. And that certainly we can see that we wouldn't want to foster mistrust in medical providers. Next slide, please. We know that community partners can and do support psychosocial care and provide that whole person care, and that it can be done. We can work together to ensure that those 6 R's are addressed. So when we talk about opening up the doors of the medical home and building what one might think of as a high-performing medical home, that this can happen in partnership between medical professionals and community organizations. And potentially that could be as simple in the postpartum period as spinning off that screening for families, so that the maternal depression and the social determinant of health screening happen at one point versus at multiple points, so that a family is having one streamlined experience. And next slide, please. And I believe I pass it back to you, Debbie.
Yes, thank you, Kim. So what we wanted to describe now is a potential partnership and how we have seen some of the starts of this in Family Connects Durham as well, to talk through partnering with a universal newborn visiting program for social determinants and ACEs screening in the postpartum period. So the Family Connects model is an evidence-based approach to supporting newborns and their families. The program is available to all families in a given community, regardless of income or background. And this approach was taken intentionally to reduce stigma and focuses on infants, families, and communities to address needs and to identify critical gaps in the early childhood system to create population-level impact. The program, while offered universally, is voluntary and it is free to recipients. The goal is for Family Connects to become part of a community system of care for children and families. Visits are scheduled around 3 weeks after the baby's birth and take place in the family's home, right now virtually, but pre-pandemic in the family's home, and hopefully a return to that in the future. And the visit's made by a registered nurse. Nurses are trusted professionals whose skill set is necessary for the medical component of the home visit, such as taking the mother and child vital signs and examining the infant. Oops. So Family Connects addresses no needs within the current maternity care system. So the current medical system provides maternity care every 4 weeks for the first part of pregnancy, then every 2 weeks beginning at 28 weeks, and then at least weekly at 36 weeks. And then this is followed by intensive 24/7 care for a few days while in the hospital or birthing center. However, the next point of contact is often not until a follow-up maternal care visit is scheduled at about 6 weeks postpartum, leaving a gap in care. Now, newer care practices have supported the addition of a visit with an obstetric care provider around 3 weeks postpartum. And this is where Family Connects can come in as a way to fill that gap or to serve as the contact point for that 3-week visit. In fact, in May of 2018, the American College of Obstetricians and Gynecologists put forth a committee opinion recommending that all women have contact with their obstetric care provider within the first 3 weeks postpartum, and cited research on Family Connects outcomes, mentioning nurse home visitors as alternative providers at that visit. So the Family Connects assessment is a 90-minute engagement with the family that covers several key health areas and opportunities for collaboration with the medical home. So first, the health assessment includes both maternal vitals, including a blood pressure check, often checking if mom had a C-section, checking on her wound as well. Infant vitals, including measurements of weight, length, and head circumference, and a full physical exam of the infant at every home visit and of the mother as needed. Validated screening tools are utilized in addition to the queries and observations of the nurse. Validated screening tools around social drivers of health, intimate partner violence, substance use, and perinatal mood disorders. And then there's evidence-based education, recommendations, and referrals that are given throughout the visit to all families, with additional education as needed and delivered specifically to the family when specific indications arise. But this includes education around infant feeding and care practices, safe sleep and sudden infant death prevention. A lot of breastfeeding support happens at that 3-week visit. Discussion about the postpartum warning signs, with particular attention paid to the areas that have been shown to increase morbidity and mortality in the perinatal period. There's discussion around parent-child interaction, assessment, and coaching, reinforcement of connection back to that medical home for both mother and the infant to reduce unnecessary emergency visits and to enhance adherence to primary care and well child care for the caregiver and the baby. There's assistance with obtaining health insurance, childcare, additional social service supports that might be helpful, scheduling postpartum care appointments if those aren't scheduled, and then referrals related to the risks that may be identified that through the discussions with the caregiver around medical concerns, social drivers, intimate partner violence or safety, postpartum mood disorders, substance use or treatment, and tobacco cessation. While adverse childhood experiences aren't screened on a validated screener, through the discussion over the course of the 90-minute visit, the nurse does hit on a lot of those areas along with the families to understand their previous experiences and how that might affect their parenting. And with that, I'm going to turn it over to Kim to talk about community alignment.
Thank you. So I think it's helpful to think about the Family Connects model not as much as a home visiting model and much more as a transformative system. And community alignment is really the secret sauce, I would say, of the system. Each program has a community alignment specialist who really focuses on the work of aligning community resources. And you can almost think of the home visit as the, if this is a wheel, it's the water that drives the wheel around and keeps it moving. We'll start with the agency finder, which is a comprehensive directory that is continuously updated with information about all of the different resources in the community that families may need. And this is a pretty in-depth document that's continuously updated. And in some communities, there are other entities, referral information and referral systems that might be utilized to supplement or in place of that agency finder, things like Help Me Grow, NowPow in North Carolina, NC Care 360, but that is something that helps ensure that families are being connected to resources in the community with the right information to ensure, and that those are high quality referrals. Every community has a community advisory board. And the data, the other piece of that wheel, where you have with a universal program, you have population level data around where there might be gaps in the system. And that so as needs are identified where families across the community are not able to access specific needs that they might have, that data can be elevated to the community advisory board to advocate for higher up to either at the local level or beyond, to advocate to bring in those resources, which may be advocating for funding, to bring in those resources to the community. Every family that participates in an integrated home visit gets a call from the Family Connects program 4 weeks after their last visit to not only check in on how the visit went, but to see whether they were successful in, so it's one of those R's. It's the, I can't remember which one it is, but following up with the family to make sure that they were successful in their connection. And if there were things that they were not able to access, that they get new referrals, and also that Family Connects program will work to determine what might be going on at that organization, why the family wasn't successful in getting that referral. And finally, the community alignment specialists and the nurses meet on a weekly basis to have a case conference. And that is another way that the community alignment specialists can get information to further look into the data and identify where there may be challenges going on in the community that need to be advanced for addressing by the community advisory board. And finally, the engagement, which is the work of connecting with the providers within the community and all kinds of other partners and community coalitions to ensure that the wheel is turning, and that community resources are all working together, and that the information that the program is learning on a population level is being utilized, and that community needs, gaps and surpluses are being addressed. Next slide, please. So where might there be barriers to this type of collaboration between the clinician and the community? In some cases, it may be just because community resources are so fragmented. There are lots of organizations doing lots of good work, but it's hard to figure out what's going on, just like it's hard for families to navigate that system. In some cases, many cases, those same organizations that are doing good work are limited in how many families they might be able to serve because of their funding. And so having that ability at a population level to advocate for the needs of families can be really important. The connections, there's that follow-up is not happening. Referrals are getting made, but nobody knows what happens once the referral is made. And finally, and this is a challenge that I think we experience in many places across the country. Lots of people are using excellent data systems, but they're not speaking to each other. They're not talking to each other. And it can still be challenging and costly to bring those systems together, but that reinforces that siloing, because there might be, we can't get to whole person care if families are getting services in different buckets, but it's not getting woven together. And next slide, please. So where does Family Connects fit with social determinants of health and ACEs? There are a lot of different things that we can do. that agency finder is only as useful as the ability to make a warm handoff to services. And that's one of the things that Family Connects does, is provides those warm handoffs to services, providing the information in a range of formats, and then ensuring that there is a successful connection. So having that feedback. We are working on integrating data systems. We use a Salesforce platform, and that is work that is happening in multiple places across the country, working to integrate with those electronic health records. But in the meantime, utilizing a variety of different means of communication with patient consent, of course, to ensure that the medical providers for the family are hearing about the strengths and potential needs that were identified during the Family Connects visit and where referrals were made to, ensuring that any information that's in that agency finder is absolutely updated, detailed, and current, and working to identify through the various screenings that Debbie talked through, and elevate those social drivers that are identified through the screening for moms in the postpartum period and their babies. So I believe I pass it over to you, Ellie, at this point.
Yep, absolutely. So Debbie and Kim have given just a fantastic overview of kind of the background of all of this. And so kind of going forward, what does this look like all together, right, as a whole? So we really propose a model where there's collaboration and intentional formalized agreements between a medical home and Family Connects, or a program like Family Connects in a community. We really think that this is going to allow and can allow for expansion of capacity for both groups, because as we know, there's strength in numbers and a good collaborative team. So we're hoping to see examples where we can have collaboration regarding screening, referrals, and follow through. Potentially, as was mentioned, where Family Connects nurses could complete the screening for social drivers of health and ACEs for families participating in Family Connects. And then through a formal agreement with medical homes, could really be able to share that information. Similarly, we want to find a way to collaborate so that all of the medical homes are put together. Debbie so nicely outlined the kind of postpartum trajectory where we have all of these intense prenatal visits and then a kind of gap. Oftentimes that gap ends up being filled in the pediatric primary care setting, where the baby is getting seen a bunch of times, but the mom is sort of getting left to wander. And so finding ways to really bring all of those groups together, to work together for better care for families, making sure that no one's falling through, and really being able to, again, take an approach where we're doing this screening and learning about families that's mindful of the 6 R's that were mentioned before. Next slide. Potential benefits of partnerships involve kind of a number of things. One is avoiding multiple duplicative screens. It doesn't feel great to go from one group to another group to the next group and have these people asking questions over and over and over again, especially a lot of the questions involved in these screens that can be really sensitive. Finding a way for there to be a universal assessment reduces stigma for the sensitive questions, and making sure that these questions are asked in a safe way. We really do have a lot of opportunity in the Family Connects model, which is a strength-based approach and a long duration of visiting, so that they're in the setting of a patient's home, or now sometimes most of the time over Zoom, but in a more intimate setting than sitting in the waiting room of a doctor's office, filling out a screener where you're being asked very personal questions. Being able to answer these questions in a safer space is another potential benefit. Similarly, we think this could really be helpful in providing a warm handoff to vetted community resources, as was outlined by the strength of the community alignment portion of Family Connects, where we really do have a finger on the pulse of what's happening in our specific community so that we can really address needs on an individual basis. Next slide. We want to close the loop here. And while this model is kind of narrowly focused on the immediate postpartum period, we do know that this is such a, as all of you also know, this is such a crucial moment for families and such a large transition, where a lot of families can feel overwhelmed and falling through the cracks. These models of connection and collaboration carve out an important role for the family's medical caregiver after a family has completed their Family Connects visit, so that the provider can follow up with family on referrals, on the success and actual connection of those referrals before they see the family at the next appointment. And I'll kind of talk about what this might look like in a, kind of patient scenario in just a second. But again, we can have significant coordination with the community alignment specialist to enhance provider knowledge of resources for future needs, and to kind of identify those gaps that might be encountered in the clinical setting. Next slide. So again, talking about some sort of real world on the ground examples of what this has looked like. At Duke, we've had a number of successes through collaboration between our primary care pediatric clinic and Family Connects. As I was mentioning in the first section, kind of that community alignment collaboration with pediatric providers has been invaluable for us. So our community alignment specialist here in Durham, Caitlin, is an incredible resource for the practice, really allowing us to have an up-to-date list of resources to provide to patients, which expands our capacity as providers on a daily basis. This connection allows me to know that services that I'm referring folks to are going to be the right ones, that they're going to be available, that I'm not going to be sending people to a number that shut down 4 years ago, and really does allow the availability and knowledge for community resources to be expanded in a way that I don't think many medical homes have the capacity to do. This was especially true during the pandemic, as both needs and the resources to fill those needs changed on an almost hourly basis. We, didn't know, was WIC open or closed? Was this mental health clinic providing services virtually or in person? What was kind of happening at any moment was really changing very quickly. And the incredible strength of this collaboration between the medical home through our Healthy Steps program, but also in our partnership with Family Connects, really allowed for the creation of a pandemic resource guide that was distributed throughout the health system and really became the gold standard for resource provision within the health system during this time. Additionally, our Healthy Step specialists completed calls for every family with a newborn, leading to more improvements in communication, and that warm handoff continuing with the Family Connects nurses, where we were constantly able to just wrap around families during this time to be able to talk together and make sure that everything was working in concert to support families. I would say that even beyond the pandemic, the most impressive thing has really been the collaboration between Family Connects and our Healthy Steps specialists within our pediatric practice. The Family Connects nurses have formed really strong professional connections with our Healthy Steps specialists who are licensed clinical social workers, and both teams work really seamlessly together to ensure that our families don't fall through the cracks. So warm handoffs are given and have become really the standard of care here between Family Connects and the medical home. And when needs are identified in the home, Family Connects nurses can reach out to the Healthy Steps specialists. And similarly, if the Healthy Steps specialists identify something in the clinic at a newborn visit, they can really ensure that the family has a Family Connects visit arranged to continue that supportive management. I can't tell you how many times I've heard folks in case conference that Kim was mentioning earlier say, oh my gosh, thank goodness this family is at your clinic, where we know that the Healthy Steps folks are going to be there, where we know that the services are going to be provided and connections are going to be continued, or folks saying, oh, I've already referred them to your Healthy Steps specialist. They're already set up in the clinic. I know everything that's going on. And this continued connection, collaboration, and really integration of the Family Connects model within the medical home has been invaluable to patients, both during and as we kind of change whatever's happening now with the pandemic. But even before the pandemic, this was really, I just think, a gold standard for the ways that we can really tie together the benefits of so many community organizations and really integrate them into the medical home to serve our patients in the most, in the fullest way that we possibly can.
Thank you so much, Ellie. The other thing that I would add, because I saw a couple questions in the chat for some of the things that I was mentioning about Family Connect and the postpartum warning signs. So in addition to postpartum mood disorder screening, some of the other areas that we are looking are for elevated blood pressure, or anything that might indicate that, any mom who has had a higher risk pregnancy, since we know that some of those pieces are what drive some of the morbidity and mortality in the postpartum period. And then building on what Ellie said in terms of how the CAB has worked with the medical home, I have a couple examples of that from some other communities that we've worked with. One was identifying that families were getting a car seat for discharge from the hospital, but borrowing it from a family member or a community member, and didn't otherwise have car seats. And this was coming up in case conference time after time. And so they worked with their CAB to identify additional resources to bridge that gap for families in terms of getting families who didn't have car seats the available car seats. Additionally, case conference offered the opportunity to identify care trends in a given community. We had one instance where we were hearing that moms who had elevated blood pressure, which we know is something that, again, drives those perinatal morbidity and mortality statistics. One practice was encouraging those families to go to the ER if the mom had elevated blood pressure that the Family Connects nurse discovered in their visit. Others had a worked out triage pathway to send those families directly to OB triage, thereby bypassing the lengthy time of waiting in the ER and the potential exposures. As you might imagine, what the Family Connects nurses were seeing when they were following up with these families was that the moms who were directed to go to the ER were more likely to not go and not actually seek care than the moms that were directed to go to OB triage. And so the community alignment specialist worked with the hospital and the different practices to kind of realign the practice standard for how that would be triaged to take the ER out of that picture. So we have opportunities where, because of the universal approach, are able to identify specific care trends and really that we wouldn't necessarily see on a one-off approach. So we're at the point now where we want to hear from you and have you all share and think about ways in the programs that you're currently working with. How are you partnering with medical homes, specifically around social drivers and ACEs, but would love to hear about other partnerships with medical homes that have been successful, and potentially how else could you be partnering? Use this time to dream, to think big, to think about what are the potentials that are out there. Just wanted to give you a little tutorial on what we are going to be using. It's my silver lining of the pandemic, the technology that I have learned called Jamboards. And if you all have not seen it, I'm hoping it will blow your minds. But it's fantastic. It's a really great way. It's a Google app, and it's a way to crowdsource opinion pretty quickly. This is not the Jamboard this is a previous Jamboard, so don't click on this one, but Ellie will put in the chat the Jamboard that we'll be going to in a moment in breakout room. So it's an interactive whiteboard system by Google. So you'll click on the link that'll be in the chat box. And when you go to the first board, you'll actually be able to click through the individual boards. You can add sticky notes. And you see right here, the little red arrow pointing at that is the sticky note icon. So you can add sticky notes, and you can choose whatever color you feel like today. So that's another exciting piece of this. You can personalize it. But in lieu of having breakout groups where we're all in the same room and able to share on our own whiteboards, this will offer the opportunity to be able to do that. So I think we're going to go to breakout groups for probably about 20 to 25 minutes or so, and have you share with each other. Anybody can post on the breakout rooms, and Kim and Ellie and I will be kind of looking at them. So if you see the post-it notes mysteriously moving, it's because we're trying to group them in themes so we can kind of echo back to the group when we all come back for an opportunity to discuss. So I think I will kick it back over to Yvonne and group, because I think they're in charge of actually sending us all to the appropriate rooms. And if there is another outstanding question, I would be happy to answer it. Oh, I see, I'm looking back in the chat. So I see one about, can Family Connect's goals be generally accomplished in one home visit as long as there is effective follow-up from the medical practice and effective referrals, and the number and frequency of home visits? So that's a great question. And so typically the Family Connect's interactions are anywhere from 1 to at max 5 visits, but usually 1 to 3. And it's not, oftentimes it's not necessarily home visits that are happening. It's follow up with the nurse to ensure that, maybe breastfeeding wasn't going so well, and they'll follow up a couple of times to just see how things are going. Really, a long-standing follow up is meant to be with referral to other programs. And in fact, more of the targeted longer home visiting longitudinal programs, where Family Connect is often one of the biggest referral sources for that. But interestingly enough, even with the shorter duration of engagement, it does appear that relationships are established. We saw with the pandemic that we had in sites across the country, many families who had received Family Connect's home visits and who were either newly food insecure or had other additional needs that were coming up, reaching back out to Family Connect because they had helped them in the peripartum period and wanted to see if they could help as well. And then in terms of specific screening tools, previous to the pandemic, no, that we did not use a specific screening tool for social drivers. It was all through queries that the nurses had. But with the move to the virtual delivery of the model, we do utilize some of the health leads social driver questions that exist there. And I don't know if I missed any questions. So if I did, Ren, if you could let me know.
We've got
Oh, I see some that just popped up. Yep.
You got them?
Yeah, I can answer are families referred to Family Connects through their hospital or their OB? So at Duke currently, there is a standing order during the hospital stay for the newborns, where eligible newborns are identified by their address, and there is an order put in for referral to Family Connect. So they are referred during that hospital stay. Once those referrals are in an order through the electronic health record, that list is then provided to one of our nurses, who then contacts families to set up their visit. And so they're then able to set up that appointment over the phone. We have a pretty good uptake of families who are contacted and then make their visit scheduled over the phone. It was a lot nicer when we were there in person and able to actually walk from room to room and say, hello, I'm from Family Connect. Would you like to schedule your visit? And as the provider in the nursery, it was really wonderful to be able to talk to families, and still is, to say, oh, great, you have a Family Connect visit. This is going to be super helpful. helpful for you, especially for families who have that worried look on their face when they're about to leave the hospital with their new baby, and you say, it's okay, Family Connects is going to take care of you. And as a mom, it's been really helpful to be able to say also, I had Family Connect visits with both of my children. They were born, and it was incredibly helpful for me. So that's one way that our hospital is working to refer families universally to Family Connect. I know that our obstetricians are aware. They are not the ones who are often putting in the referrals, and especially since, as Debbie mentioned before, the postpartum visit is really not until 6 weeks after, so far beyond the Family Connects window. But certainly they know that there is a resource, and we have some really strong connections with our obstetricians in the community.
I'm just looking at some of these other questions in terms of website or literature to share with families. Each Family Connect site does develop a web presence. It's part of the planning process. In Durham specifically, the website has information about Family Connects and also has a way for families to sign up directly on the website, as well as a lot of our pediatricians utilize that website if a family hasn't had a scheduled visit when we see them in the clinic. That's another way that we do that as well. And also through the planning process, in terms of that community alignment piece, as Kim mentioned, there's very intentional provider alignment with identifying OB and pediatric champions, family medicine, et cetera, midwiferys, doulas, to be able to be part of that planning process. In terms of planned alignment between Family Connects and the Integrated Care for Kids pilot in North Carolina, absolutely. We're really fortunate that both Ellie and I are faculty at the Duke School of Medicine, and as is Dr. Charlene Wong, who's on the Duke side of the North Carolina Integrated Care for Kids proposal. And we've had a lot of conversations with her around that policy lever, right? The policy lever that we may be able to incentivize medical homes to be able to have partnerships with evidence-based programs, to be able to, whether that's through alternative payment models or an early childhood bundle of services, or what does that look like? I think we're all still trying to figure that out, but I think there's a lot of opportunity there. And then as far as military families, if we are in locations where there are military families, absolutely, we're a universal program, so we engage, with any family in the given communities that we're in. Currently, we're in 40 sites in 17 states, and so have had a lot of growth and expansion through the years, which has been really, really exciting. And Kim, do you have a list of I'm wondering if this is a question specific to North Carolina counties that offer Family Connects?
Well, and I'll put in the chat our website where there should be an updated map of it. Unfortunately, it's not county specific. It's at the state level across the country where we're either in active planning or implementation. In North Carolina, we have active programs right now in Guilford, Durham, and Forsyth County, and then planning underway in Transylvania and Wake. And as part of the preschool development grant, we have planning underway in, and I am new to North Carolina, so I may not get these right, Watauga, Avery, Ashe, Cumberland, Hoke, Robeson, and I am blanking on
Polk?
Yes. Polk, Henderson and Polk, thank you. I was in Colorado last, and I'm between Ohio, Colorado. I'm still learning my North Carolina counties. Thank you. So we have planning going on in a number of communities right now with the preschool development grant in North Carolina, which we're very excited about. Should we move to our breakouts now?
Yeah, I think that would be great.
Okay, and so I'm just going to ask one question. This is Yvonne, to make sure, are there any other questions team that we may have missed? Okay, so we think they're all covered. They're all covered. I'm going to open the rooms now. Thank you. Hi, Deborah. I think, do you want to, if you move your slide, we can see who's not it.
Yeah, let me just stop share.
Stop sharing, I'm sorry, yes.
I think Ellie and I were both in a breakout room, so we came back.
Oh, no, I'm glad you did. I saw that you were leaving. I was like, no, come back.
So it looks like there's one breakout room that only has 2 people. Should we move them?
Let's see. Let's see.
It's room 3 has just Tristan and Amy.
It looks like there's still a few people in here who've not been.
Majority of us are
Are you all
staff.
staff? Okay.
Yeah.
You guys did a wonderful presentation.
Oh, thank you so much.
Yes.
Okay, there. So it looks like room 3 doesn't have anybody, but everybody else has at least 4 people.
All right, I am having something weird go on with my slides here. I'm going to end the slideshow.
Would either of you like to go into one of the rooms?
I think we're okay. I think I'd like to see if people are able to get into the Jam boards.
So
I'm
people are
having-
in there. I see there are 13 people in the Jam boards.
Okay.
So not everybody, because there are, 50, there were 50 people in the like full things. So it looks like only 13 people have made it over to the Jam boards. And thanks, Ren, for sending that to everyone again. And then we're getting a few comments, but not a ton.
Yeah, I can see that as well. It's kind of quiet on the Jam boards.
Yeah, sometimes it is until people figure it out. So the other thing that I have found helpful is to kind of goose the Jam boards with stuff that we want to
Yeah, I think
add
I'm gonna
to.
go do that right now.
Yep.
Yeah, so far I'm not seeing stuff that looks like partnership. Like telling people what to do.
Well, but I think that's really helpful, because I think that's clear. That's a lot of underscoring the point of why this kind of integration is so important, is because it doesn't really, my sense is that it doesn't exist as much. Like there's very siloed efforts. So I think that's helpful. We'll have to think about, we can leave people in groups for 20 minutes or so and just have some brief share out at the end. And I'm running to the restroom really quickly. I'll be right back.
Good. I'm adding something to the Jam board to start conversation.
Yeah, I am too.
That was fun though, Kim. I think that flowed really nicely.
Oh, did it? Thank you. I felt like I was kind of goofy. I don't know. I was so embarrassed that I blanked on the all the counties. But there, I know I'm working across the country and the county names, we have statewide in Oregon, and so many names are the same or just
Right?
different.
I know. It's like, was that a Oregon county?
I've got Marion and Polk launching
Yep,
in Oregon
in
and
Oregon.
here, and I
Henderson
think
and Polk here.
yeah.
No, I know. I had to think about it too, Kim. And not being from North Carolina myself, I never took the class that my kids have taken in 4th grade of
Yes.
North Carolina.
Counties of North Carolina.
Yep.
Yeah, thank you. I thought you guys did great. I hope I did okay.
Oh, you did awesome.
Did great.
I always love presenting with both of you. So thank you
That's
both
fun.
so much.
All right, I'll go back on the Jamboard.
Sounds good.
Let's see. There are more people in there now for sure.
Yep.
Oh,
And more stuff
yeah.
popping up now,
Good.
which is really good.
Because I put one thing on each board.
So Ellie, one of the things that we might be able to talk about, just to share back, is I'm seeing in the barriers, they're challenging to like get in, and I get that. And so I think that, that's been one of the things that we've been thinking about a lot. When I've been working with community alignment is like, how do you identify the practice champions? How do you get in there? So, I like that.
I'm just thinking about the barriers also that Guilford has had about, like they're just cold calling like a practice manager.
Right.
And that's, whereas, I texted Carmen and Reach Out and Read is up at Greensboro Peds now. They started this week.
That's awesome.
It took less than a month.
That's awesome.
Yeah. So let me,
And then Yvonne, we can, what I'll do is I'll send you the link to the Jamboard, because we can share those out to the group just so they have record of it afterwards too.
Perfect. That would be great.
Oh, that's a good question. If physicians get paid for doing the screens, why would they want to offload the screen?
That's my question.
That's a great question.
That was mine.
Oh, well, great question, Kim.
Yeah, it's
Something Kim and I have talked about a lot.
It was a little provocative, so I thought it might be a good one to ask.
And that's why we're talking about policy levers for, incentivizing practices to have this kind of engagement. So.
So they have about 15 minutes left, okay?
Great.
And if you decide you want them to come out earlier, just let me know. But
Yeah, I
15
think we probably do want them to come out earlier just because we're finishing up at 11:30 11:30, right?
Yes.
Maybe we'll
Yeah.
bring them out at 11:20.
Okay.
That's great.
Does that sound all
Will do.
right? And then,
I agree with that.
okay.
Okay, I will.
How do you guys want to share this out to folks?
Do you want to each take a board?
Sure. How about, Kim, which, do you want to take the first board? Because the only reason why I'm thinking I'm happy to take the second board, because in the barrier, I can actually speak to some of the things that we've been doing to try to engage with the provider community, like around, creating these provider councils and things like that.
Sure, what's this, do you want me to just read these out or?
I think just, like it sounds like there's a lot of, ways that individuals are partnering, with medical providers. I don't know. What do you think? We don't have a ton of time. That's the only thing. So we could potentially
Maybe I'll
even-
just read 3 of the examples.
Sure, that sounds good.
Why do I do
Pick
that?
your favorite 3.
Okay.
Yeah, and I don't really see a theme emerging. There's definitely more of a theme in the second one that could be,
Yeah.
but there isn't really a theme here. There's more of a theme on the second and third ones.
And I wonder, Ellie, if we kind of tag team that stuff in terms of like the opportunities to engage, we are the providers. And from what I can tell, we're the only providers on this in terms of, representing the medical establishment.
And I think we can call that out, right? And just say, like, there should be more, there should be more people here.
And so I think what is often, so I think things like potentially partnering with, partnering with the local hospital and, trying to find the places like find your champions, right? Because they're often the entree point into the rest of the health system.
Okay, I've got 3 that I can, if we want to go out and I can take the first board, I've got 3 that I pulled over to the side that I can use as examples.
Awesome.
I move them and then somebody moves them to someplace.
I know. It's probably Ellie. She moves my Jamboards all the time.
I get really OCD about it. It's my it's my like subclinical ADHD that just like moves stuff around and I can't quite. Although I think the pandemic is making my subclinical ADHD a little bit more clinically relevant.
I feel you.
Okay, I've got my 3.
All right, and I think I'll be able to share. I'll just share my second screen when people come back to be able to. I mean, I guess I could. I don't necessarily have to share the Jamboard. We can just kind of talk it through.
Yeah, I was just going to read the 3 that I selected.
That sounds good.
Because other people have them all pulled up so they can see them.
Yeah, so do we need Yvonne to bring everyone back?
I think in 4 minutes.
Yep, 4 minutes.
Oh, okay.
Whenever you're ready. Okay.
I'm gonna grab something to drink.
Go right ahead.
Okay. I'm adding another comment.
Now I got all OCD on my board and made it all like line up.
Look at you.
But then I made a couple of these, I don't know how I made them turn.
I moved it back for you.
Thank you. And I've got another one over here that was.
Got it.
But I was like spacing them.
I got your back, friend.
Like it needs to be all orderly.
Okay, I'm gonna let everyone back in. It'll do a
Alrighty.
countdown for a minute, okay?
Yep, sounds great. Kim, your board looks pretty.
Very concerned about keeping it organized.
Yvonne, should we have everybody back now? I think so.
I believe so.
Awesome. I'll turn it over to you, Kim.
Thank you. So I have the first board. How is your program partnering with medical providers around social determinants? And lots of good responses here. And I'm just gonna point out 3 of them that were specific programs that spoke to a little bit of information that I thought would be interesting for us to hear around how they're partnering. So it looks like Mecklenburg Pre-K has a family support specialist that connects families to services as identified issues emerge in the classroom. At Nurse Family Partnership, they refer families to medical providers and focus on health coaching, as well as prevention and management of chronic illness. And Early Head Start works with expecting mothers, follows along with medical appointments and anything to do with the overall development of the baby. And I am going to pass it on to one of my colleagues for the next board on what has been successful and barriers.
Thanks, Kim. Looking at the success and barriers, it definitely echoes a lot of the challenges that we've had in the communities that we've been in with Family Connects as well. And it's a lot of the time that I spend in the space of thinking about provider engagement. And specifically in Durham, it's the space that Ellie and I occupy a lot of trying to break down those silos, because there really is a significant silo in the medical realm. And then all of the other wonderful things that programs are doing, oftentimes it is hard, as people are saying, to kind of break in and to even gain entry into that community. Some of the things that folks have been successful, we've definitely found success in as well. Having lunch and learns that provide back when we could, lunch and learn together, having those with providers. Really key to the whole piece is finding your potential provider champions. And sometimes that may be engaging at the in our regard, since we're in the mother baby newborn space, engaging with individuals within in the hospital that are at the mother baby unit, often able to point us in direction. Sometimes there might be different committees that the community alignment specialist is sitting on throughout the community, and there may very well be a vocal pediatrician who sits on those, and that's often a good, which could be Ellie and I take that role sometimes, and they're great folks to reach out to just say, hey, do you have? We really want to engage more closely with the medical provider community. Could you help us? Because if you have somebody to gain entry into the community, somebody who's already a quote unquote insider, that I think is often very helpful. It's much harder to cold call a practice and to connect in that way. So I think that's definitely a way to do that. I think there's definitely pushback in terms of sometimes getting into the practice, but looking for opportunities, whether it be a grand rounds at a community hospital that a lot of your providers would engage with, or even sometimes on a broader sense, partnering with a we've got a rollout happening across the state of Oregon now, and so we're partnering with the AAP chapter that's there and individuals that are involved there to be able to kind of crowdsource more and gain more provider champions. Ellie, what else would you add in terms of what you have seen effective? I think particularly I'm thinking through the collaborations with the newborn nursery and things like that.
Yeah, I think it really finding a hook, finding a personal connection, finding that that story at the heart of all of this is really helpful. Asking your own medical providers if they're interested in doing this. I think that could be, if you're taking your kid to their checkup, talk to your pediatrician. Like, hey, did you know that I'm part of this? Or talk to your medical provider. Did you know I'm a part of this? And having those personal connections can be really helpful. I'm thinking during the pandemic, one example that shined out for me of a personal connection is one of the nurses came up to me and said, Ellie, I just, all these moms, we're sending them home. This is a postpartum nurse. And she said, we're sending them all home. And I just wish there were more resources that we could give for them. And I said, well, you know what? Family Connects, and she hadn't been familiar with Family Connects before that. And once I talked to her and had that kind of direct conversation about it, it opened up just kind of like the floodgates for all of our postpartum nurses to really come in and join forces around really making sure that families are aware of and signing up as quickly as possible for Family Connects before discharge. So I really think that those personal connections, as Debbie was saying, like getting to the right person can really be helpful, because oftentimes we'll find that folks will cold call a medical practice. They'll get a front desk staff person, or they'll get someone in the administrative group who may not have a comprehensive understanding of the ways in which there could be a potential partnership there. So finding ways to really make those personal connections, I think, can be incredibly helpful. I see a couple of things, with barriers of timing for things. If folks are, needing to enroll before a certain time, again, maybe finding different locations for where patients are being seen. So I'm thinking in the OB space, maybe all of the patients are being seen at one clinic location for their, anatomy scans. So maybe that location is different than when where they're getting their kind of regular visits. And so, maybe there could be an opportunity there. Another barrier I'm seeing in, being a large county, many providers and many offices, absolutely. We can't boil the ocean, right? So let's start with one practice at a time, and move slowly. And the great thing about that is that oftentimes the providers know each other and can say, hey, I'm at practice A. My friend who trained with residency, trained in residency with, is at practice C. Hey, we got this connection to this program. It's really awesome. Don't you want to try it too? And kind of finding that way of connecting, and then using the providers to be able to connect you directly to other providers, I think is an incredibly powerful tool. If you have someone who is already really engaged and bought in, using that connection to make other connections can be really helpful. Last thing I'll say is, I just lost it. There it went.
I can
I'm
pick up.
sorry. Yep,
I have
take it,
one last
buddy.
thing to say too, which was it is one of the things that somebody mentioned was offering to share the resource directory, or that basically thinking about how your program can expand the notion of the medical home, can really extend the provider's capacity, I think is essential. Because when, one of the slides that Kim presented is so true, providers in the OB space, in the family practice, pediatric care provider space, all, when they've been surveyed, all agree that social drivers of health are important to be assessing in our families, but we are so often scared to ask and really petrified by finding something and not knowing what to do. And so the more that a practice knows about the resources that exist within the community and can build on those resources and expand on those resources and really engage deeply in that's often the hook. And that's often the thing that can be incredibly helpful to be able to shine what you have to offer. So I know that the best part of our presentation is there's a prize at the end. And so I just thank you all for your participation. We will make sure that these Jamboards are shared with you if you had some ideas that you saw on there that you wanted to make sure you took back to your groups and your teams as you're thinking. I hope that you continue to remain invigorated and engaged and enthusiastic and hopeful. And hopefully for those of us that are tired or sore or stiff, we can get some rejuvenation this weekend. So thank you all for your time. We really appreciate the opportunity to present, and I'll turn it over to you, Yvonne.
Wonderful. Thank you all so much for this wonderful session. There's a lot of great information here. So I want to thank you again for being with us today. I want to remind everyone that you may go back out to the website and please complete the survey. Also, handouts are listed there as well. And if also, I do want to remind you that we have a special sponsorship session coming up with Lakeshore. There will be a grand prize winner, so we don't want you to miss that. So right now here, we're going to crank up the Lakeshore video for us to give away a prize to a lucky winner in this session. So let's see, Jonathan, are you gonna run the video for us? Let's see. No video. Wonderful. Well, that's okay because we're a little bit on time. So today's lucky winner is, I'm going to pull this winner, and that person is, let me make sure I have the correct winner for us today. And we have Amanda Ratliff. Amanda, are you still with us?
Yes, I am.
Wonderful. Congratulations. You are a Lakeshore winner today, and you will be receiving a wonderful gift from Lakeshore. They will send it directly to you. If you would email me your contact information and where you would like your gift mailed, that would be great. So again, thank you all for attending. I look to see you at 11:45 in our next session with our sponsor. Wonderful, wonderful. Thank you all so much. And if we can help in any way, just give us an email at conference@smartstart.org. Thank you. Bye-bye.
Thanks, everybody.